Hey everyone, good evening. This is Dr. Sullivan back with you for another edition of I Care for Your Brain. We have been doing this every Wednesday night at 6 o'clock for over a year. And it's been a great way to get to know so many of you throughout the country and really throughout the world. And it's been a great honor to be able to be with you and to be your trusted guide for scientific, objective information about the brain and mental health. These are things that I'm really passionate about, things that I really care about, and I try to pick topics that I think will genuinely touch you and will genuinely help you guys out there. So recently we've been talking a bunch about therapy, and last time I was with you we talked about something called theoretical orientation. And the whole idea of that is that mental health clinicians have a certain frame of reference that they use to figure out how to make sense of the struggles that you bring into therapy. So we talked about somebody could be cognitive behavioral, they could be psychodynamic, they could be humanistic, but no matter what the theoretical orientation is, most of us really truly believe in the therapeutic relationship as a primary vehicle towards people becoming more insightful about their issues and really making behavior changes that will help them be more satisfied, more happy, less traumatized, less grief-stricken, all those things that we seek out therapy to help us with. The thing about all therapies is that there has to be a certain level of respect for this very unique relationship. And that's what I wanted to focus on tonight, which was what are some musts, some non-negotiable elements of the therapeutic relationship. And I wanted to put these out there because I think sometimes people do a great thing for themselves by seeking out therapy, but sometimes they can get matched up with someone who maybe isn't showing the most professionalism. A lot of people out there are wonderful and they have excellent intuition and they have excellent boundaries, but unfortunately in my job I get to hear some stories of things that are completely opposite to that. So it really inspired me when we're talking about therapy to want to empower you all out there to know, these are some basics that really have to be there for you to continue trusting and working on that therapeutic relationship. So one of the things that most of us who do therapy think about is something called the therapy container or the therapy frame. So what I mean by that is basically the fixed elements of therapy that kind of hang on the outside of the sessions to make sure that there is the most security and the most safety that can happen within those 55 minutes, right? So part of the reason we do that is because so many of the issues that drive us to therapy have to do with issues of security and safety. So many of us struggle with having been abandoned, having traumatic loss, having not a lot of predictability, having themes of not being safe. And so one of the core strategies for good therapy is just to provide a lot of predictability, and that's part of what we call the frame or the container. So part of what you have to do to make sure that that concept is there and is intact is just what I call the basics. So this is starting and ending on time. I understand that sometimes things happen on either end, sometimes for the therapist or for the person, and we get started a little bit late. But that really is not okay when that happens consistently, because that frame, being able to predict that this is when my session starts and this is when my session ends, kind of provides those bookends on the therapy that lend itself to feeling like this is something I can depend on. I know exactly what to expect. There are no surprises here. So most of us believe if you don't have that frame, that you really can't do therapeutic work. So it's very important that you have a physical space to do your therapy in that feels comfortable, that is quiet, that is confidential, that kind of marks a different type of way of being than your typical life outside in the world. So part of the way that we try to do that in therapy with a thoughtful clinician is really designing the physical space to make people have more intention, to be aware of their surroundings, to be comfortable physically, so that way hopefully they can let their guard down mentally. And so we want to make sure that we're in an environment that has nice furnishings, that is well painted, that there is, it smells good, that there is just a sense of care and concern for creating a certain physical space around you. One of the nicest things someone said to me recently was that when they came into my practice to see a counselor that we had who works here, that they just really felt like it was kind of turning the page into a different world, and that this was a world where she was greeted very warmly, that smelled really nice, and that when she sunk into our couch in the waiting room, that there was a certain amount of relief that was released from her body, a certain amount of tension that she could just let go of just by being in the physical space. And that was just such a compliment to me and the intention that I try to have throughout everything that we do here. I have been in some other practices where there was zero attention paid to the physical surrounding, where in fact they just encourage people to go into their attic and their garages and just bring in any broken furniture, and that's what we're going to set up the waiting room with. If you're in an environment where there's things are dirty, where there's broken furniture, if you have to be there and you don't have any other choices, that's one thing, but that's really not the elevated level of respect that we want for somebody taking the big step to be in therapy. So tonight, the way I organized our lecture is for us to think about 5 musts that have to be there for you to know that you are in a good, healthy therapy relationship. So the first one I've decided is that there has to be a judgment-free zone. So what do I mean by this? When we go into therapy, part of what we need to be able to do is to really let our guard down and realize that we are not having a normal social conversation. This isn't the same type of communication that you would do in a friendship. This is different. This is where you can really let it all hang out, let your non-socially desirable aspects of your personality kind of flow. And part of why we want to encourage people to do that is because then their defenses are able to relax a little bit, and things that are in people's unconscious can come more readily to the surface. Part of why we have defense mechanisms is because there are times in life where we feel too vulnerable to express what it is we really think. So we do all sorts of things, denial. We can get mad about things that we don't even realize why we're getting mad about them, because the thing we're really mad about is outside of our awareness. So a big part of therapy, especially for psychodynamically oriented providers, is that we want to have a certain free association of thoughts and feelings. So a lot of times what brings people into therapy is that there are themes in their life that are not going well. They start to realize, wow, there's a pattern here of getting into bad relationships. There's a pattern of self-medicating with alcohol or food, or I'm tired of self-sabotaging, I want to reach my potential. And these things aren't typically based on one life experience. They're kind of a pattern that if you were able to talk about things very freely, you might start to develop awareness that, oh, maybe this is connected to this, which is connected to this. And that's part of our job as a therapist, is to increase your awareness, your insight about how themes are connected in your life. If you feel that when you start to say something, someone judges you for a belief that you have or an action that you've taken, that's really going to make people clam up, and they're not going to feel like they can really truly be themselves and let it all hang out. Now, of course, there are limits, and there are certain things that do need to be judged in therapy. And these come down to abuse and neglect, right? Part of our job as therapists is that we have ethical and legal mandates where we are mandated reporters. And what that means is if we feel that you are in significant and real danger of hurting yourself, someone else, or neglecting or hurting a child or a vulnerable person, like somebody with an intellectual disability or an older adult, then we do have to judge, and we do have to break your confidentiality, and we do have to try to make sure that you're safe and other people are safe. So there are some limitations on judgment in therapy, but really it should be the kind of place where you don't feel that if you said something off color that your therapist would judge you and feel differently about you. Okay, this is where that whole idea of Carl Rogers' approach, unconditional positive regard, comes in, because we really want you to feel like your therapist cares about you and accepts you for all that you are, not just the socially acceptable parts of yourself. Part of not being judgmental means not being reactive. Okay, so part of what a therapist has to do on our end before you come in the room is to really be grounded and get outside of our own head. And part of what we need to do is to make sure that we are giving you our undivided attention. And that can't happen if we are consumed with things that are going on inside our own life, because of course we're human too, and we have fights with our spouse, and maybe sometimes we forget to pay the bills, and we're getting calls from the IRS. I mean, all sorts of things happen to us as mental health providers. We're not immune just because we have expertise and education. So it's very important that you feel like when you're in a session, not only are you not being judged, but you're really being listened to in a very intent, focused way. So if you don't feel like you're getting the undivided attention of your person, that's a problem, right? Because most of us go through a little bit of a ritual before we see patients, which is just to take some deep breaths, try to clear out of our own agenda, really try to be open to what the person has to bring to us in that session. Number 2 is self-disclosure must be selective. And what do I mean by that? Self-disclosure means the therapist talking about things that are personal to them. Now, throughout the history of psychotherapy, there have been a lot of changes in the way that people get trained about this issue. More classically trained psychodynamic therapists believe very strongly that you shouldn't even wear a wedding ring, that you should be a complete blank slate, so that way the patient can basically project onto you whatever it is they need you to be in those sessions, right? So if you're completely neutral, then all the conclusions the patient has about you and your likes and your dislikes and your personality are basically a reflection of their own beliefs. So that's a very kind of strict way of being. In contrast, there's the whole other world of alcohol and substance abuse treatment, where it's very normal for people who are recovering addicts to become treatment counselors and to be open about their own struggle with addiction. And that's kind of part of what validates, they've walked in my shoes, so there's somebody who can advise me about recovery. So it really does depend on kind of the subspecialty, but there are definitely some very important rules around this. One of them is that when a therapist talks to you about something personal, it should be very occasionally, in my mind, because otherwise the focus of the therapy shifts from you to the therapist, okay? The other thing is that they really should be thoughtful in the way that they self-disclose. If you start to feel like your therapist is kind of in their own therapy, or they're kind of going on and on about some of their own struggles, that's not really that therapeutic, and it can actually kind of backfire. So one of the reasons why we sometimes use selective self-disclosure is because it can model for people appropriate boundaries, being able to talk about something a little bit and not kind of overflow with it. It can definitely reduce shame that people have if they kind of feel very stigmatized, like some type of mental health symptom is very abnormal, and they're kind of holding the therapist in this godly regard. It can sometimes be really therapeutic to say, I too have struggled with depression, or I too know what it's like to lose a parent at a young age. It can really help the relationship. So it very much depends on what is specifically going on for the therapy patient. But what's so important is that the therapist is mindful about this and really thinks through the pros and the cons. So some of the pros might be that it could increase the trust in the relationship, but then it confuses the boundary about what is this relationship, because maybe it starts to feel more like a friendship, right? And that's one of the things we have to talk about in a minute, is how is the therapy relationship different than a friendship. There isn't equal reciprocity, right? The patient is the one coming in doing, hopefully, all, if not most of the talking. And so it's really not a space of equality where people are getting to know each other in the same way. So there's no way that it could really be a friendship, right? This is part of why we have to make sure that we are not friends on social media, that when we see each other out in the world, there can be a connection and a warmth there, but it's not the same as kind of catching up socially with your friends. So another one of the cons of it can also be that if you knew something that your therapist was really struggling with, maybe you would judge them, and maybe you would lose a little bit of confidence in them that they had the skills or the ability to really be able to help you. Sometimes it can be helpful because a person may feel a little bit less alone, knowing that the therapist has gone through the same issue, but oftentimes it more interferes than it does help. And so we want to make sure that we're using self-disclosure minimally. It has to relate to your issues. If you start to feel like the person's bringing in something that's not related, that's a problem. And a good therapist is always going to try to ask themselves, am I saying this? Am I thinking of sharing this because it's going to be of therapeutic value to the person? Or am I being triggered about my own stuff and I'm feeling like I want to share my stuff? So it's not the sharing that we really need to focus on. It's more the intention. Why is the person sharing? Okay. Number 3 has to do with empathy, which is the cornerstone of all good therapy, right? We all want to feel understood and validated. But with empathy in therapy, we have to make sure that it's not too little and it's not too much. We don't want our therapist to seem cold and unfeeling. But there is something called empathic reactivity where the therapist can be too emotional. So in normal empathy, the idea is that you can really feel the pain of someone else, right? You can really put yourself in their shoes, and that gives you compassion and it gives you a sense of understanding. The problem, though, is that if other people's feelings feel so real and intense to you that you almost drown in the emotion and you can't be that objective helper, that is really your responsibility to be as a therapist. So, if a therapist responds to something that you say by crying uncontrollably or, saying things like, I don't know how you ever lived through that. I don't think I could manage. I think I would just want to end it all. That's a great concern, and I've heard those stories. So when a clinician responds with any sense of hopelessness because they seem to be getting too emotional about your story, the real thing that's wrong with that, besides feeling like, God, can this person really help me, is that the person can feel like they are inflicting harm on the therapist. And a lot of people who've been traumatized really worry about hurting other people. That's one of the after effects of trauma. That's one reason people tell us they don't tell their stories, is they don't want to make anyone else feel upset, right? Which is a very empathic thing for somebody to want to do, but we know that's very unhealthy over time, and we need people to express their emotions, express their rage, express their grief. But if they feel like they're going to overwhelm the therapist or upset the therapist by talking about their issues, that's not really therapeutic. We also worry on the clinician side about burnout. If you're getting so caught up in people's stories and losses and you see 5, 6, 7, 8, 9 patients a day, that is very emotionally draining. So very important to think about that. Number 4 is valuing that this is a very unique relationship, but it is not a friendship, and there are boundaries on the patient therapy relationship. One of the stories that prompted me to want to do this lecture tonight was hearing about a therapist and a patient who for their sessions would go in the back of the building and smoke cigarettes together and talk about the therapist's grandkids. That was a true story. And that is very disturbing, okay? So this is not a social hour, right? This is treatment. It's a very important thing to remember that. But it can get confusing because for many people, the therapy relationship is maybe one of the first ones they've had that has real emotional intimacy where they can really be open and really be heard and validated. So it's very important to have that container, getting back to that idea, or the frame, because then you have kind of a foundation of sturdiness to explore some of those feelings if the patient starts to feel like they're developing feelings, or why can't we be friends outside of the therapy hour. It's very important to always make sure that this is a very unique relationship. And yes, the relationship is the vehicle to the treatment, but we are here for treatment. This is not, it is a paid therapeutic relationship, and that gets hard sometimes too, because people don't like the idea. That can be a part of resistance in therapy, is why should I have to pay someone to listen to me? But what you have to keep in mind is it's not just listening, right? It's interpreting, it's guiding, it's helping, it's supporting. So number 5 in my musts of good, healthy therapy relationship is to make sure you're reviewing progress and goals. If you don't have a map for your therapy, which we think of as kind of the treatment plan, then you really are aimless, and we need to know where we're going in terms of growth. What are we doing in terms of the dysfunctional patterns that we're trying to break, making sure that we are grieving things that need to be processed directly. Every few sessions, you should be talking about progress with your therapist. There's people who've been in therapy for 5-10 years who are just as unhappy and just as disconnected as they were when they first started the therapeutic relationship. So I always want you to be monitoring. Am I getting better? Am I getting healthier? Are my coping skills becoming more positive? Am I becoming more self-aware? Are my relationships improving? You really need to make sure that not only are you getting understood and comforted in your therapy, which are very, very important, but that you're also really being taught something, that you are internalizing positive coping skills from the therapy relationship. Because the whole idea, after all, is that you take what you learn in that relationship into the outside world. That's the whole idea of therapy, is that you learn to have a good, well-boundaried, positive relationship with your therapist, and then you can take those skills and apply them in your life outside that 55 minutes. So that's why it's so important that the person who is giving you your treatment make sure that there are themes of predictability, that they can be reliable, that you can count on them, but that it is appropriate, and that we recognize this isn't the type of relationship where you should be calling at all hours of the night and expecting a call back as soon as the person gets into work, right? This is a relationship that has rules and boundaries, and you have to look to the therapist to set the stage. So being respectful and appropriate of what those boundaries are is probably the most important thing in a therapy relationship. So I thought about the lecture for next time, and I thought maybe doing defense mechanisms would be helpful, because we kind of touched on that in tonight's lecture. But next week is actually Halloween, and I'm not going to be with you because I will be out trick-or-treating. But the next week after that, that next Wednesday, I will be back with you, and we will talk about defense mechanisms, which are very interesting and something we all do all day long. So thank you guys so much for being here. It's really a privilege. If you thought this was helpful, I would love for you to share it. Try to get the word out there about good therapy relationships. It's so important that people know that they have a right to not only have access to mental health, but good quality mental health treatment. Thank you guys so much, and I'll see you next time. Bye-bye.